Welcome to Module 5 of the Competencies Addressing Religion and Spirituality in Couple and Family Therapy. We're glad that you've made it to this final session.
This fifth module will focus on applying the CARS principles we have learned thus far to clinical scenarios and situations. Throughout our training, we have been discussing ideas that we believe will help you in your journey towards competency addressing religion and spirituality in couple and family therapy. This module's objectives are to reflect on our comfort in a parenting case with a religious problem, then assess the religious and spiritual needs of the parents in treatment, discuss family CARS research concepts that will be applied to this case, and apply some of those family therapy theory principles to a religious problem in the family. And to help our memories, these 4 ideas actually spell out the word CARS. So that's comfort, assessment, research, and systems. Okay? So let's dive into a case study and apply some of the things we have learned to this case.
Imagine you have a new case of a young couple. Both partners are Buddhist and heavily involved in yoga and meditative prayer. The couple is second-generation Malaysian, living in a large city in the USA and working in a family business. They requested couple therapy to assist with adjustments with their 5-year-old daughter, who is newly diagnosed with autism. The couple would like to use their prayer, meditation, and yoga practices to help them cope with the stress of parenting and be more accepting of the diagnosis. Let's see how this couple is addressing the problems of parenting.
I'm anxious about how we are going to parent Sanjana now. I was already nervous about becoming a parent and keeping up the business. Now, I just think we can't possibly keep going the way we have been going.
I really think it's going to be okay. I know he is really nervous about it, but we're both educated and have our parents' support. I think we must accept this as part of our lives now, with compassion, and we must seek wisdom for our best response. We might have to adjust our lifestyle for the medical and psychological treatments, and I'm worried about that, especially since we plan to have more children.
You mentioned in our intake that prayer, meditation, yoga, and acceptance are important practices for both of you. How have you used these practices to ease your anxiety?
It has been really difficult. I try to meditate, but my mind keeps returning to wonder whether there's anything else we should have done or should be doing now to give Sanjana the best life. My grandmother recommended I try to return to a state of rest and acceptance, but my mind keeps drawing me to activity.
That's me too. Although I think mostly about how to cover the business responsibilities if Sanjana can't go to regular preschool anymore.
Let's break down this case to consider the best way to address spiritual and religious issues in particular. So first, you might even try to stop the video and jot down some of your own thoughts about spiritual issues for this couple and these parents. So the first step would be to identify your cultural comfort reaction and response to their religion. You might ponder your own experience with Buddhism. What emotional response does this bring up for you? You might also consider your own experience with being religious or spiritual in general. Unless you have a lot of commonality with them, you might find some anxiety about understanding their experience without making some mistakes. So our awareness is job number 1. Once you reflect on your comfort, you can consider what is your expertise with Buddhist religion of people from Malaysia who have immigrated to the United States. And this is a very unique intersection of diversity. You might need to consult on the case if your expertise is low or if your competency with RS is lacking. Our ethical response as a clinician is to curiously engage in learning and growth mindset, but always living within the ethical boundaries of our professional training and role.
You might think about what else you need to know about this RS in the family. Your paperwork might have indicated they were Buddhist. You might follow up with the 4 assessment questions from Module 3. You already know their religious identity. You can learn the prominence, effectiveness, and inclusion as we've talked earlier. It is important to be clear and not promise more than we can deliver to clients regarding spiritual practices. It is a good idea to clarify with clients as to their own expertise with their particular spiritual practices. The therapist might say, I'm not a practicing Buddhist, but I will learn about the way you practice and support you in it. Would that be acceptable to you? Therapists can support clients' spiritual practices in ways that support their treatment goals. For instance, in this case, the therapist could share information from mental health about anxiety and mind wandering. The therapist might encourage the mom, the wife, to find principles from Buddhist teaching on how to respond to mind wandering and anxiety when meditating. The therapist wouldn't be able to give the Buddhist teaching herself.
And even if a client or a family practices the same religion as a therapist, that doesn't mean the therapist is competent to provide spiritual guidance or direction. The role of clergy is distinct from the role of mental health provider. Clinicians should consider how to collaborate with clergy and not assume the role of a clergy. In addition, the wide variety of spiritual beliefs and practices within the same religious group, or even in the same religious community, precludes extending the therapist's own personal practices or traditions to the clients. So we want to engage the client's or family's preferences, normal practices, and spiritual strivings within the boundaries of good mental health care. In fact, this ethical limitation is parallel to the concept of exclusion and embrace. We embrace our role as mental health provider, and we are excluded and not part of the religious community of our clients. But being at peace about that role is a really important congruence.
We know from research on spiritual coping that spiritual practices can be helpful, even more when families share the experience. The mother's worry is preventing her from her usual spiritual practices, and she is looking to her husband for support and feeling lonely when his response isn't what she needs. The common faith is becoming a wedge issue. They also appear to be struggling to cope with the loss and grief that comes with a diagnosis like autism. The therapist might ask how the diagnosis changes their hopes for their daughter, or if they experience loss. Then the therapist might try to tie the concept of loss back to ask about their Buddhist teachings on loss and disappointments.
Collectively, this could all be conceptualized as a religious impairment, which is an important understanding of clients who are struggling with their faith practices. Religious impairment happens when psychological, or in this case, family problems are causing spiritual struggle and a decrease in their regular practice.
Next, consider what kind of principles from systems theory might help you to address spiritual problems in Buddhism with this family. The first principle, recall from what we've already talked about, that non-anxious presence. You've got this. We've practiced it. You know it well. Even if you aren't familiar with Buddhism, you are familiar with this non-anxious presence that you present. While we encourage reading to understand their religious values and practices, you don't have to become the expert. You can ask the couple good questions, or you can seek supervision or consultation. As a therapist, you might practice your own spirituality or religion as a principled way to reduce anxiety by doing things like increasing acceptance or praying blessing on each person in the family. We have also found remembering our good therapeutic conceptualization and training can also reduce our and their anxiety, trusting that our training and experience will guide us in addressing these RS problems.
Second, we can demonstrate multi-directional partiality. Regardless of whether you use contextual family therapy, you can validate the father and his concern about managing their business with the new diagnosis. And you can also join in with the mother in feeling sure that they will figure it out. Your empathy for this is really powerful. Simultaneous bi-directional empathy is power multiplied.
Third, create and honor differentiation by asking how their faith tradition is built to help them in difficult situations like this. Their pain currently sits between them, and the conflict is attached to their respective views on how to practice Buddhism.
And let's not forget the big issue. Their daughter has autism. They might have intense reactions, responses, and emotions. They are trying to use spiritual practices, but they're ending up in conflict about them. The parents might see the yoga and prayer practices as creating a wedge between them, even though they both agree and they regularly practice together. But couple and family therapists can reframe their religion as a resource in the face of tension. You can ask something like, what are the principles from Buddhism that help you when you face grief and loss? What has been helpful to the two of you in the past whenever you have relationship conflict?
This family might find themselves offended and alone, disconnected from one another. The husband is focused on the impact on their family business. The wife is focused on trying to stay positive and use spiritual practices to cope with this diagnosis. This may seem to them to be incompatible goals, but using exclusion and embrace, separating and joining, they focus together on how to live together with the differences in focus and embrace each other's concerns and goals as shared. They might ask each other how they can share and embrace each other in this difficult time. Let's just hear how this could sound in therapy. I see how the different ways you're addressing this problem is causing tension in your relationship. And you both express loneliness and anger. I wonder about the principles from your family, your culture, or Buddhism that might help you in being different from one another, yet still needing each other. So how are you different from each other?
Well, I know that I want to accept things and meditate to handle this problem. And I'm really having a hard time with it. But I feel angry at the universe about this diagnosis and alone in trying to accept this. I feel like a bad Buddhist because I shouldn't be angry about this.
I feel alone in the business. Like I'm carrying the responsibility to keep things up so that we have all the things we need. I know this kind of striving is not our way of handling problems.
Those are such good words. I hear grief and loss, that you're both feeling and accepting the diagnosis, and in keeping up with the work around the business. And I hear that you seem to be feeling guilty, like layered with anger around your faith. I'd like to talk more about that later, but now can you tell me how you each need each other? Or better yet, can you tell one another how you need each other?
I need you in this business. You handle the hiring and managing the schedule and training people. I really am not good at that. I don't want to overwhelm you, but I do need you.
I need you to come to morning meditation and yoga at the temple with me, and let your mother keep our daughter.
You know, I really do need that too. I have missed our morning walks to the temple together.
That is very important, each of your needs, and you explain them so clearly and helpfully. It feels like perhaps your spiritual connection to each other has been a loss that you're feeling right now. This must be so difficult.
In this exchange, you can see the therapist helping the couple give voice to their needs and give equal importance to spiritual practices and to business needs. This reflects the opportunities for exclusion and embrace that you find in all kinds of couple or family therapies.
We hope we've created a journey of great ideas in addressing religion and spirituality in couple and family therapy. Thank you for participating in this training on family cars. We hope the journey has been enjoyable and engaging for you, like a fun family road trip.
We would like to extend our hope and blessing to each of you as you increase your competency in addressing religion and spirituality in your practice.